Breast implant illness. What is this? Is this real? What can be done about it? What are the risks? There's lots that we need to talk about, and we're going to do it today. Here we go. Hi, I'm Dr. Z. I'm a cosmetic breast specialist, and if you have any interest in breast implants, lift, or reduction, you're going to want to subscribe and hit that notification bell so that you don't miss a thing. Today's topic is really complex, and it's something that's being talked about more and more every day on social media. Breast implant illness. It's not an official medical diagnosis, but it's definitely something that we hear and see a lot about. Is this something that's real? Is this an actual medical disease that is causing women to get sick because of breast implants? To be honest with you, nobody knows, including myself. But I know there's something going on out there that is causing women to have a constellation of symptoms that can't be attributed to any one particular thing. I have patients come in almost weekly who are otherwise healthy and have been having over the past several months or years a variety of symptoms such as fatigue, chest pain, hair loss, muscle aches, brain fog is a big one, memory loss, skin lesions, rashes, a lot of seemingly unrelated things which most of the time in medicine we might attribute to an autoimmune disorder. And these women have been struggling for years trying to figure out what is causing them to feel so sick.
I have been struggling for months with food intolerance, foggy memory, having problems carrying conversations in ways that I've never had problems before.
Why is breast implant illness, or this entity that women self-identify themselves as a part of, on the rise? It definitely has to do with social media. Not to say that social media is the cause by any means, but it certainly accounts for the rapid increase in awareness and in discussion. I know there's a Facebook group out there that has thousands of women participating in daily discussions about their breast implants and the symptoms that they have. For years, we've been studying silicone breast implants. There is no current link between medical grade silicone and any medical disease. As I've mentioned in a previous video, there's never been demonstrated an allergy to silicone, meaning there's no antibodies that our bodies make to silicone, and there's never been a medical diagnosis of illness attributed to silicone. In 1999, the Institute of Medicine, committed to the investigation of safety of silicone, conducted an extensive review looking at all the available literature and concluded that there is no link between silicone and any systemic illness. So silicone implants are used readily, they're on the market, and are amazing devices. I use silicone gel 99% of the time in my breast augmentation patients, and I love them, and my patients love them. However, there still exists this question: is there a risk? A lot of times in medicine we end up looking at things backwards. You've got a problem and you have to come to a solution. And the patients who present with this constellation of symptoms that I've previously described as breast implant illness, they self-identify. They say, after a long time of searching and testing and looking at all the different possible things that could be giving them GI problems and all the other things, the only thing left is my breast implants, and it must be my breast implants are making me sick. So of course the automatic question is, does removing the implants make them better? The answer is sometimes. Absolutely. I've seen patients who I removed their implants and they tell me afterwards that they get better. I have to admit though, this is rare. Most of the time after taking out implants, I don't see patients again. They disappear. They don't come back for follow-ups. I don't hear from them again. I don't know if their symptoms are truly improving or not. There are some questions that I have about this, and it particularly pertains to the rapid resolution that some patients claim to have. What I mean is, The theory is that silicone leaches into the body's tissue, systemically spreads throughout the entire body, and causes all of these different problems. So you would suspect that removing an implant from the breast itself is not going to immediately cause a resolution of all of these problems, because you have silicone throughout your body, in your cells, in your tissues. I have a few patients who tell me the day after surgery they were 99% better. Their fatigue was better. Their rashes were no longer itchy. Their mind started to work more clearly. And that raises suspicion for me. I don't think that a chemical spread throughout your body can clear itself so quickly that all of these symptoms go away. It doesn't mean that these patients are lying. It doesn't mean that these women don't actually feel better the day after taking out their implants. But it does beg the question, is the link biologically related to the silicone itself, or is it more of a mental link? Mental conditions are real. Psychological problems cause real problems. So that could be playing a part in some of these patients. I'm not saying that this is a psychiatric disease or that breast implant illness is only in people's heads. By any means, I'm not saying that. But I think that the brain has an amazing capacity to hurt itself and heal itself. And so knowing that something that is causing you distress is out of your body completely can certainly start causing a immediate healing in your mind and in your brain and in your body.
And I feel so friggin' awesome.
How about the other women? How about the ones who gradually improve? How about the ones who take months and maybe even years before a lot of their symptoms get better? Those are there too. And a lot of times patients will say, I'm starting to feel a little bit better, but it's not quick, and I'm hoping that it'll continue to improve day by day. Then there's the ones who don't get better at all. And most of these I don't hear from. Some of them we do hear from. And it's disappointing. It's actually very disheartening to talk with a woman who has been putting all of her hope in removing the implants in order to regain some of herself back, to regain some of the normalcy she used to experience in life. And it doesn't seem to be happening. That's really the saddest of all. And so breast implant illness is something. It's something real. It's something out there. It's something that people truly experience, but we don't know what it really, really is. For those who say you're a cosmetic breast surgeon, you're a plastic surgeon who's invested in doing breast surgery and breast augmentation, and you're going to deny the facts of breast implant illness's reality, that couldn't be further from the truth. I am a physician. I'm dedicated to treating my patients in the way that is most suited to their well-being, and I want them to feel better about themselves. When I meet someone and they say, what do you do? I tell them, I help women feel better about themselves. I help men and women feel better about themselves. That's my job and that's my passion. If I'm doing something that I don't believe is helping you feel better about yourself and is good for you, then I'm not doing my job and I don't feel right about it. So I want to know the truth. I want to get to the bottom of everything that I do. Breast implants are amazing for a lot of women. It has changed the whole outlook on my patients' lives, on their self-esteem, on their confidence, on the way that they approach their everyday existence. Not because breasts are all that matter, not because your implants can make you a different person, but because one little thing that has been causing you some self-esteem issues or has kept you from feeling totally secure in your body has been improved and is out of the way and is no longer an issue in your total person.
I will tell you to this day, 11 years later, it was one of the best decisions I ever made. Zero regrets.
So no, breast implants don't solve everything. Breast implants aren't a panacea, but they have helped a lot of women improve their total body image and self-esteem. And I know for a fact that at least 90% of my patients have said to me personally, and after many years on follow-up, this is one of the best decisions I've ever made. Breast surgery, whether it's a reduction because I no longer have the pain and the suffering with heavy breasts, breast lift because things are kind of back to where they belong, or breast implants because I've got the fullness and the shape that I've never had before. These have been life-changing surgeries, and in many instances, women tell me, the best decision I've ever made. On the flip side, there are women, a lot of them on social media, and a few of them in my practice, who come to me, honestly not from patients that I have implanted, but patients who've had surgery, and I guess they usually don't tend to return to the same surgeon that put them in if they have problems. But patients who've come back to me with a story that I had implants placed, I loved them for a long time, and then I started to have these symptoms, or from day one I started having these symptoms and I didn't pinpoint it until I started reading on Facebook or on Instagram a lot of stories of women who had the same things, and I thought instantly, this is me. I have these problems, I have these issues, and it's got to be my implants. Will you please take them out? And absolutely, I'll take them out. Your body is controlled by you alone, and if you have a foreign body, an implant, a medical device inside of you that you don't want inside of you, we're taking it out. I'll talk to you about the different options, about what I think may or may not be going on. I'll talk to you about the literature and the statistics and all that we know in the medical community about breast implants and about breast implant illness, which admittedly isn't very much. But at the end of the day, it's your decision to remove them, and I encourage removing them if you think you are being made ill by something that's in your body. So the next question is, how do we remove the implants? Do you just simply take it out? Do you do a total capsulectomy? Do you do an en-bloc explant, which is what most of the breast implant illness community is proposing? Well, it varies, and I think that talking about this is just as important as discussing whether or not the implants should come out. To put an implant in through an incision that is 1 inch or so in the inframammary fold beneath the breast, in a periareolar incision, or even through an axillary incision in the armpit, all of these are meant to conceal the scar and minimize it. When you're taking an implant out, ideally you would remove it through the same incision without making it any bigger, and this can be done in a simple explant, removing the implant alone. If you want to remove the capsule because it's hard and contracted, or there's other issues related to the scar tissue surrounding the breast implant, usually that can be done through a small incision as well. Explant with an en bloc excision, which means removing all of the tissue surrounding the implant that is in proximity to the capsule. The implant, the capsule, and a thin layer of normal breast tissue, so that this can come out as one solid unit, requires a much bigger incision. An en bloc incision is usually 2 to 3 times longer, about this long, than a standard implant placement incision. One thing to be aware of. Also, it's a little bit longer surgery and a little bit longer recovery. If there is a reason to do so, then you do what you have to do. But does removing all of the capsule and the tissue surrounding it in one unit necessarily required in order to take the implant out of your body and alleviate your symptoms? I can't say that it is. I don't really know. And I have done all sorts of removals for patients with breast implant illness, and they all seem to do about the same afterwards. There's not a noted increase in improvement of symptoms in the en bloc patients versus the ones who have simple capsulectomy or just simple removal with leaving the capsules intact. I haven't personally done a thorough scientific study. This is just anecdotal, and based on the evidence that I have in my practice, I haven't yet seen a difference. What should a physician do if they encounter a patient who has these complaints? The first thing they ought to do, whether it's a primary care doctor or a plastic surgeon, is believe your patient. Patients don't come to us typically making up stories because they're seeking attention. The amount of people out there doing that is infinitesimally small. In the plastic surgery realm, we see a lot of different things, but patients coming in with great breast implants, feeling good, loving their body, and having no symptoms, don't come in making up stories asking to have them removed after they've invested so much in their breasts. they are experiencing something, and what they're experiencing is real, and it's disconcerting, and it's making them feel bad. So we must believe our patients, empathize with our patients, and do whatever we can to help them feel better. By the time they come to me, usually women have had a full workup. They've seen their primary care doctor, an internist, a gastroenterologist, a dermatologist, a rheumatologist, and the complete works has been done, and usually come up with very little in the results. There is no direct answer for why they're having these problems. The removal of the implant is usually the last resort, and I'm happy to do it. As I said, if you want them out, you're getting them out. We're going to have a good discussion. We're going to go over the options. We're going to talk about what we know. But after this thorough discussion, including always an explanation that there is no guarantee that removing your implants is going to help you feel better. I hope with all my heart that it does. But if you take your implants out and you don't feel better, it's sad, but there is no guarantee, and I never even allude to the possibility of a guarantee that taking these out is going to help you, because that's misleading. Would I feel comfortable with a family member of mine or my very own wife receiving silicone breast implants or breast implants of any kind? And that's a good point to make here at this moment, because it's not just silicone gel implants that are a concern for women in the breast implant illness community. It's all breast implants, including saline implants, which are a silicone shell filled with salt water inside. Traditionally considered to be extremely safe, and most women who in the old days were worried about silicone breast implants causing some type of sickness or autoimmune disorder switched to saline implants, which still had a silicone shell and had no problems at all. So this confounds the issue even further. But would I feel comfortable with my wife getting breast implants of any type? Absolutely I would. My very own wife. I wouldn't do the surgery myself, but I would have one of my colleagues who is experienced and knows what they're doing and that I trust put them in, and I would feel very safe. The thing is this: you can always take them out if you have to, but rarely do women have to take them out because of breast implant illness. It exists. This constellation of symptoms that we're talking about is out there. It's a small minority of patients. If I do thousands of breast augmentations over my career, and 99% or greater of them do not experience breast implant illness and 1% do, it doesn't mean it's not real. It means it's a small subset of women who do not agree with implants, and they might not agree with a foreign body of any type. My current thought, after really thinking about this a lot and still trying to get through it, and still there's a lot of research going on to this day by the American Society of Plastic Surgery, by the American Society of Aesthetic Plastic Surgery, and by different organizations throughout the world. Now that the awareness is increased, there are active studies going on into breast implant illness itself, and we're going to learn more as time goes on. We're going to find out what's true and what's not. But at this current stage, with the limited knowledge that we have, I can only go on my clinical experience. And my clinical experience tells me that most women do just fine with breast implants. Most women have no systemic illness, have no symptoms that are caused by their breast implants themselves in other areas of their body, in their mind, in their gut, in their skin. But there are some who maybe do. And I look at it as maybe a type of let's use this analogy, an allergy. My son has a tree nut allergy, and he can eat peanuts, he can even eat almonds, which are tree nuts, but every other kind of tree nut causes him to have itchiness, hives, and he doesn't like it. Does that mean that tree nuts are bad? Does that mean that the majority of people in the world can't tolerate tree nuts? No, most love tree nuts. I love tree nuts. I eat walnuts and I eat cashews and all those things, and I don't have a problem, but my son really does. So when you find out that you've got a problem, you eliminate it and you avoid it. And I think most women honestly do just fine with breast implants. I've had patients with silicone implants in their body for over 30 years and have had no problem. Sometimes they get capsulated, sometimes they get firm, sometimes they just stay fine and they have no problem at all. and they would never dream of removing them. But for the small minority of women who do have a problem and who do have these issues and who can't figure it out and want to have them removed, I think it's worth removing them, and I offer that surgery. For the few people out there who don't do well with something foreign in their body or who don't do well with tree nuts, it's a real experience, and I think we have to really look into it further and really trust that with more experience and with more research and with more data, we'll know how to treat these patients better. So would I feel comfortable with my wife getting breast implants? Yes, I would. I absolutely would. However, if a couple of years or 10 years or any time afterwards she developed a ton of symptoms that were unexplainable and matched what other people are calling breast implant illness and we couldn't figure out why, absolutely I would be alarmed, and absolutely I would tell her to get those implants out. It's not going to be a common occurrence, but if you do enough breast surgery, you're going to find patients who have these concerns. Our responsibility is to learn more, to trust the patients, to do whatever we can at the moment to help them feel better. Sometimes it's reassurance. Sometimes it's changing to a different type of prosthesis. Sometimes it's doing a little bit of research into the patient's medical history or their lab work to find that there is something else going on, that it can be treated with medication. But in those who have what they call breast implant illness and they want to have their implants taken out, then it comes to the point of discussing how's it taken out, what can you expect, and doing what we can at the moment to help our patients get better. So in 2019, we have a limited amount of data to work with, but it's growing. And I'm going to be updating you guys regularly as we learn more in the scientific community and in the medical community and in my personal experience. More videos to come on breast implant illness in the future. More videos to come on safety of breast implants and the changing technology. And I'm talking about you guys too. Gynecomastia is something that I treat, and we're going to have a video coming out very soon on gynecomastia, or enlarged breasts in the men. So thank you guys so much for joining me and for listening and for understanding that this is a partnership between patient and physician, and we're going to move forward together, and I hope that you will stay tuned with more videos to come. Please subscribe, hit that notification bell, and you will get an update anytime I got some more news to share with you. I want to hear from you. Have you experienced breast implant illness? What's your story? Please comment below and we're going to talk about it.